I was thinking, after I had surgery, the surgeon came to talk to me and she said, we removed 8.5 liters from your legs. And I remember thinking, what? How? What? That's a lot. Because I'm thinking of like, say, a Diet Coke bottle, a 2-liter Diet Coke bottle. Yeah. Like 4 of those plus a little bit more. Right. Like that's a lot. Yeah. So I was thinking, amazing, done. I won't have to do, at least I won't have to do my legs again. Like after she said that, said, we'll probably have to have a second go at your legs.
Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, 2 Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment.
So 2025 year for you was probably a big year for you in terms of finding some stuff out.
Yep.
About yourself.
Definitely.
Maybe kind of go into like 2025 year and like how things transpired and how it ended up where you're at today.
Okay. Right. If I back up a bit, I would say earlier in the year, maybe April, May of 2025, I started noticing pain, just pain in my body and like all over. And I didn't know why.
Like aches?
No, because I think I would have just assumed that was perimenopause, like joint pain or aches and pain. And it was different than that. So I knew it wasn't that. I mean, I didn't know that it wasn't related to perimenopause or menopause, which I guess in a roundabout way it is. But no, I knew it was different. Okay. It was more like, I would describe it as, when you're getting sick and you have a fever and your body is sore.
Oh, yeah.
And worse when you touch somebody, or worse when like you rub against something, or when you have certain clothing. Like, so that type of extra sensitivity all over my whole entire body. At the time, like I was like, this is weird. I've never felt this before. I don't know where this is coming from. I also had a pinched nerve in my neck at the same time. So I was kind of Googling, I was kind of thinking, I guess it could be related. It's probably related. One, like they're both showing up at the same time. It's probably related. So I wanted to get some more, the pinched nerve in my neck progressed and kept getting worse. So I ended up going to see my doctor. And while I was there, I also brought up this pain all over my body. And it didn't seem to her that it was related, but she didn't know what it was. And then I went to a neurologist because of the pinched nerve to get more information and to find out if it was something to worry about. And I asked him about it. And he kind of shrugged and was like, I don't know what that is. So it did not, this was now becoming apparent to me that it was not related to the pinched nerve. And then I went to a third doctor, but by this time I had already done a lot of...
Was it getting worse as well?
The sensitivity? Yeah. No.
Oh, okay.
But it was constant. Okay. Like I can be sitting in the car and I can feel it like on the back, like above my butt. Yeah. And it's just like anytime my clothes touch my legs, I can feel it. If my clothes touch my arms, I can feel it. It wasn't, funny enough, in my like waist. Like I didn't feel it in my waist at all. So it was like, oh, that's weird. But then like if I'd go to the bathroom and you have to obviously pull down your underwear and your pants. That would hurt, like to do that. Okay. So I had gone on Instagram. No, at first I had Googled like all of this stuff, and you get, obviously, as you do when you turn to Dr. Google, you get everything under the sun, right? It's cancer, it's this, it's that. So that really kind of wasn't helping. And then I ended up on Instagram one day, and randomly, like on my, you should follow this person page, was somebody who looked like me, like had legs that looked just like my legs, and they were talking about lipedema. And I was like, what? No, I don't have that. No.
So you've heard the word before?
I had heard of it, but didn't know what it was.
Okay.
And didn't think twice about it. But then this one day, whatever kind of triggered that, like, in me that day, I think it was the fact that I could see her legs and they look like mine. And that made me kind of go, well, could I have this? So, of course, once you start looking at one thing on Instagram, you end up going down this rabbit hole.
It ends up in your algorithm.
It ends up in your algorithm. So then there was another video and another video and another video. And they were talking about pain and talking about sensitivity and talking about... So all of these little pieces started getting put together. Yeah. And then I went to my doctor.
Okay.
A different doctor who is a specialist who I have appointments with every so often, and asked about her experience with lipedema. And she said she had only had a little bit. And so at that moment, I had already looked up, is there a specialist on the island that I can go and see? And so I asked her for a referral to go see a specialist and talk more about it to find out if this is what I have and if this is what is causing this pain in my body.
And she was fine with it?
Yeah. Okay. Oh, yeah, totally. Great. Yeah. She was like, definitely. And like wrote it right then and there, the referral to this person. So that was a good chunk of 2025. So from when I started having the pain was like around April, May. And then I went to see the specialist in August. So all of that time kind of just not knowing, probably part of me just chalked it up to normal perimenopause, menopause, aging type pain, also the neck. So it was, it was a lot.
So then for anyone hearing this word and learning this word for the very first time, how do you describe it in like simple terms?
So I'm actually going to read it because like I'm not a doctor. I'm probably going to say some stuff that, you know, might not be everybody's experience with lipedema or might not be what a doctor might say. Okay. But like I'll read this definition, that lipedema is a connective tissue disorder that mostly affects women and seems to be driven by hormones. It's a chronic condition where fat is distributed abnormally, most often in the legs and sometimes in the arms, buttocks, and abdomen. That fat behaves differently than typical body fat. It's inflamed, often painful, can bruise easily, and doesn't respond normally to diet and exercise. So... obviously I had looked it up and read that before I went to the doctor. And so a lot of that I was like, okay, check. Okay. Because I did feel inflamed. It was painful. I do bruise easily. And I have tried every diet. I have done every diet for decades and decades and decades, and with success, but never to the point where I would notice a difference in my legs. Okay. Never to the point where I would notice a difference in my arms. So my waist would get smaller, my chest would get smaller. And so I would lose weight. So I thought for many, many, many years, it's my fault. Of course it's my fault. I'm not training hard enough. Of course it's my fault. I didn't eat perfectly today. Of course it's my fault. And on and on and on. Until the age of 51, when I was finally diagnosed with lipedema.
And with lipedema, there's different stages?
Yes. Okay. And this is very confusing to a lot of people too, because a lot of the information online contradicts each other. There isn't one kind of overriding source that says this is this and this is this and this.
Like, so here's the photo, and if you look like this,
they do kind of have that, yeah. Okay. But you know, like I've seen women online, like who are, you know, on Instagram, and they are lipedema pages on Instagram, but this person looks different than this person, and this person is saying that she got diagnosed at stage 2, and this person saying she got diagnosed stage 3. Okay. And so there is, I think it depends on the doctor, it depends on a lot of things, but generally there are different types and different stages. So there are 4 different stages, and those are based on how the tissue has changed or changes over time. Okay. So in the beginning, more softer. As it progresses, it gets more firmer, more nodular, and more painful. Okay. Then there's there's 5 different types. Yeah, so the types are where it shows up in the body. So whether it's just the legs, a lot of people are just legs only, where they have lipedema. But it could be legs and arms. It could be legs, arms, and buttocks. It could be legs, arms, buttocks, and abdomen. So yes, that's how you get a stage and a type diagnosis.
And then where did you fall within?
So I am type 3. Okay. So not 4. There are 4 stages. No. Okay. So the type is where it shows up in the body. So I'm type 3.
Okay.
Where it shows up in the body. So I have it in my legs, my arms, the shelf above my butt is what she said, and my abdomen.
Okay.
So a significant number of places.
Okay.
And then stage 4, which...
Well, that makes sense because you would have been sore. Like that's where the soreness comes in, right?
That's how the tissue has changed over time. I might have some of that information backwards, but there are 4 or 5 stages and 4 or 5 types. And the types are where it shows up in the body, and the stages are how much it's progressed.
Okay.
So I think I'm near the 4.
Okay.
It's quite nodular. Like I can feel, I thought this was normal. I've obviously felt my legs before. Before I knew I had lipedema, I felt my legs. I thought everybody's legs felt like this. They're quite bumpy and hard. It feels like beans or peas under the surface of the skin. Not everywhere, but in a significant amount of places. Like if I run my finger, like my thumb along my thigh, I can feel the bumps, and you can see the bumps in my thigh. I thought that was normal. I thought everybody's body was like that.
Which I guess leads me to my other question of why is this so often misunderstood?
Yeah, because...
One, by the patient.
Yes.
And then 2, by the doctor.
Okay, so many things, right? I think there is, like everything in women's health, there is a lack of education, lack of research. So the doctors don't know. I, like I said, I'm 51. Well, now I'm 52. But at the time, I was 51. Right. I had never, ever, ever had a doctor say anything to me about you might have lipedema or let me look at your legs, let me feel your legs. Never. Like when I was younger, when and again, like I don't know how long I've had this.
Right.
I was only diagnosed at 51. I mean, I don't know.
Well, and then there's also a side that like you probably would have never thought to say something to the doctor about your legs because you always thought that they were normal.
Yeah.
So it's...
Well, and I've been just under the impression that it's my own fault. Just open any fat person's page on Instagram and you will see comments. Work harder, work out more, eat less food. What's wrong with you? Anybody can do it. Why can't you? You can do it. You're just lazy. You're not trying. And I have put in the work.
Right.
I've had personal trainers. I've tried, this program. I've done this. I've worked over the years a lot. And also tried many different nutrition plans, and I've tried many different nutrition plans, and I have tracked my calories, tracked my this and that. And I could lose weight, but very, 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 very slow. And again, it had to be perfect. Or I would tell myself, you have to work out. You're not working out hard enough. You only worked out 3 or 4 times this week. You need to work out 7. What's wrong with you?
Right.
You had cheese for breakfast. You can't have cheese for breakfast. You're going to but it's this mental journey, this mental thing that I was so down on myself. I was so blamed myself for it.
So did this, I'm sure, well, and we talked about it when you did get diagnosed, but anger.
Yeah. I wanted to go back first about why it's misdiagnosed because it looks like regular fat.
Okay.
It just looks like cellulite. If
I was going to ask if.
Yeah,
okay.
It definitely does. It looks like, and I'm sure I do have cellulite too. So that's part of it's just my legs, but also it just looks like, regular fat and regular cellulite and regular weight gain. But inside, it's just very different.
Right.
Yeah. Once I did get the diagnosis, and even still, I've been sitting with this since August. So many different emotions. I'm relieved to know that I do have this answer and there is a name for it.
Right.
But I'm also very angry for all the years that I spent working my butt off and not having this answer.
Right.
And also, I don't know if I'm angry, but I'm disappointed in all the doctors and all of the personal trainers and all of the nutrition programs and all of the go on and on and on that I, put money into and never got the results. And I'm not blaming them because I just don't think that the information is out there. but why can't it be? Like, why isn't it?
Well, not disregarding it, but like, look at all of the women that are now in their 60s and 70s that weren't able to use HRT
yeah.
and like the similar kind of anger as well, right?
Yeah. And even like, I know endometriosis is a big one, and PCOS, and it's all the same story over and over again. And how my life could have been different. And I think, like, forget about all the programs that I did, it's money. I put so much money into my health and into, the way that my body looks, because I wanted to feel good and I wanted to look good. Yeah. So there's a money side of it, but there's also this mental side of it. Like, if I could get all of that back and take all of that back, I think that's what I'm the most regretful of, I guess, is how down on myself I have been and how much I beat myself up over the years.
Right. Yeah.
And not knowing.
Yeah. And we can cut this part if you want, but is there like would you not do something with this and like start creating more awareness?
I might.
Yeah.
I'm considering doing more social media about it.
Especially for women down here.
Yeah. I'm considering it. Yes, I want to. I don't want to be like, there are pages out there that are like solely like lipedema pages, like their whole focus is educating, but I might do other things too, like, this is how I dress with lipedema, or this is how right? And that kind of thing, because it's not going to go away. I will always have it. But also, it's the only thing that would maybe make me second guess or make me do second thoughts about it is just the negativity and
you're putting yourself out there.
You're putting yourself out there for hateful comments and mean comments. And because I've done that to myself for the past 40 years, do I really need to hear this random gym bro tell me to just go work out?
Right.
And I mean, maybe I'm at the point in my life, I know that perimenopause has changed a lot for me and helped me give a lot less F's. Oh my God, for years, like, I wouldn't even wear a swimsuit in public. I still don't wear shorts if I don't have to. But yeah, like, now I do. Like, I don't wear shorts, but now I go to the pool and I go to the sauna, and I really don't care if somebody's looking at my body in a way that...
Good for you.
And
this was even like
This is pre-diagnosis. This is more perimenopause, I think, showing up, and you just being like, this is what I look like, take it or leave it. Yeah. If you don't like it, don't look.
Right. Yeah.
That's up to you. So a part of me might be okay with putting stuff out there into the world.
So you got the diagnosis, and then now there's a choice of something that you need to do. Because can you just live with it?
Yeah.
Or is it automatically where it's like, no, we need to get you in for surgery?
No.
You would just always be in pain.
You would. There are ways to manage it conservatively. And a lot of people choose to do that. A lot of people are happy to do that. The pain, like, I don't know how, like I said, I don't know how long I've had this. Yeah. The pain only showed up for me in perimenopause with the hormones. So it can show up, lipedema can show up in somebody's life, or I guess it tends to. It has a tendency to show up in hormone periods.
Yeah,
so like
puberty.
In puberty, in pregnancy, and in menopause. Okay. So yeah, for me, the perimenopause and the hormone fluctuations, I guess, is what set it off.
Right.
Or what kicked it up a notch.
Yeah.
And so, yeah, if I didn't have the pain, I don't think I would know what this is. I would know that I have it because I wouldn't have seeked out anything, any more information. Yeah. But a lot of people, like, and I wonder if I was diagnosed at stage 1 or stage 2, if the conservative measures would have been okay. A lot of the stuff I had already been doing, drinking lots of water, eating an anti-inflammatory diet as much as you can. I mean, it's hard because anything that's, shelf stable is inflammatory. Sugar is inflammatory. Alcohol is inflammatory. Right. Carbohydrates are inflammatory. So everything, a lot of things are inflammatory. But trying to focus on an anti-inflammatory diet, which I think I did for many, many years, which I guess probably helped me to a degree. So that type of thing helps decrease the inflammation. Also, compression garments can help with swelling and inflammation, manual lymphatic drainage massage. Yeah. Okay. I actually started getting those probably 2 years ago, just because I thought it might work. I thought it might help me as far as losing weight and feeling better. Yeah. Being less bloated, being less inflamed. The other thing that I've stopped, or that people would probably do if they didn't want to go the surgery route, is the high intensity workouts. Stop doing those. Like I was doing like the HIIT workouts, the F45 for years and years and years. That type of workout can increase the inflammation.
Okay.
So I've now I focus more on Pilates and walking and yoga, like you, to try to decrease some of the inflammation.
Okay.
There's other things. Some people get a vibration plate can help with the lymphatic drainage. Yeah. So there are things to do. And for a lot of people, that's enough.
Okay.
To help them not be in pain and to feel good, day to day. But for me, I had specifically noticed a change in my body, and I knew that I was progressing more rapidly than I would want to. Okay. I noticed like my thighs have always been big, but I started to notice my calves were also getting this fat buildup, and also my arms getting bigger and bigger. So I noticed this progression, and I had already been doing a lot of the conservative things, and that it just wasn't helping.
Okay.
And then the pain, for me, the pain wouldn't go away no matter what I did. So I decided to have surgery.
What do they call it?
It's the liposuction for lipedema.
Oh,
Yes, lipedema-specific liposuction.
Okay.
Yeah.
Okay. So is lipedema liposuction, is the surgery different than regular cosmetic surgery?
Yes.
Is it?
Yes, it's very different from cosmetic liposuction. It's considered a medical treatment.
Okay.
Not cosmetic. And the goal isn't weight loss or contouring of the legs. It's to remove the diseased, painful fat while preserving the lymphatic system. It's a special technique, like surgeons who are specialized in lymphatic lipedema.
Oh, and we have someone down here.
Yep.
Amazing.
Yeah.
That's great that you didn't
And I'm
have to
happy
travel.
if anybody wants to chat with me about it. I'd be happy to chat with my experience and who my surgeon is. I had a very, very positive, very, very good experience. Like my first appointment with her, I went in and I said, like, I think I might have lipedema. And basically kind of looked at me and said, yeah, you do.
Was it like, yeah, how are you just figuring this out now? Okay.
Not at all. It was more of a like, yeah, I can tell that you do. And then she like went over it, like, well, I see this, I see this, I see this. And I left feeling so good because it was probably the first time that I felt validated. I felt seen. Yeah. She answered all my questions. She had really great questions for me too. And I left just like it was a weight lifted off and something that I didn't know I carried.
Right.
For 50 years, potentially.
Like literally and physically.
Right. But yeah, so she's a specialist. So they are trained specifically in lipedema liposuction.
Okay.
And my surgeon had done like thousands and thousands and thousands of them. But yeah, the difference, I guess, the main difference is that it's not about, trying to look good and trying to get my legs to look good. It's more about, I started with leg surgery, I guess I should say that.
Yeah.
Yeah. But I mean, at the end of the day, it's more about slowing the progression because I was really, really nervous that I was going to progress more and more and more, and also improving the quality of life.
Okay. And so you said that you went for the legs first.
Yeah.
You were not going to go and get all of them done at the same time.
No, you can't, because there are laws, there are regulations. You can't remove more than a certain amount at a time.
Oh, okay.
I think they're different for different areas, but I think they're all around the same amount, because it's not safe.
Yeah,
it's not
sense.
safe for the patient to have that much. Plus, also recovery would be terrible.
Yeah, because that part for you was
really bad. Yeah.
Yeah.
I mean, we can get
we'll
get into that. Yeah.
Okay, so will surgery cure it?
No. Okay. No. There isn't a cure for lipedema. It's a chronic condition, so there isn't a cure right now. What surgery will do, though, is remove a significant amount of this diseased fat, reduce the pain, reduce the heaviness, improve my mobility, and in many cases, slow or stabilize the progression, which is what I'm hoping for. Okay. And is hoping I continue to do all those other things that we talked about, those conservative measures. Yeah. It will.
When did you get it done again?
At the end of November.
Okay. So what are you?
I'm 9 weeks.
Wow.
9 weeks post-op right now.
Okay.
Yeah.
Oh, it's still fresh.
Yeah, believe me. Yeah.
Okay. And then the legs are going to heal. Like, are you going to go in for another surgery?
Yeah. So
I know when we talked about this, you're like, oh my gosh.
Absolutely not. I was thinking, now that I've had it done, it's a completely different thought, right? Like, so I was thinking, after I had surgery, the surgeon came to talk to me and she said, we removed 8.5 liters from your legs. And I remember thinking, what? How? What? That's a lot. Because I'm thinking of, like, say, a Diet Coke bottle, a 2-liter Diet Coke bottle. Yeah. Like 4 of those plus a little bit more. Right. Like, that's a lot. Yeah. So I was thinking, amazing, done. I won't have to do, at least I won't have to do my legs again. And she, like, after she said that, said, we'll probably have to have a second go at your legs. And I was like, I doubt it. Like, that's a significant amount. Why? Yeah. I doubt it. Because I'm not worried about how they look. So I'll be fine. But now being 9 weeks post-op, also, with how difficult the recovery was, I was like, right. I probably will be fine with just the one and done. But now that the swelling is going down, or has gone down mostly, I can feel like most of, I think, where the fat was taken was from my calves and a little bit from my thighs, but I still have a significant amount of lipedema in my thighs. Okay. And it hurts, and I can feel it, and I can feel it there. I can feel the nodules. I can feel the pain. So now that I am 9 weeks post-op and not 2 weeks post-op, I can see myself. I'm not sure. Yeah. I'm still in the middle of it, but I can see myself doing the rest of my legs again. Not for a while. I'm not planning on doing that right away. My legs are still healing. I still have numbness. I still have pain in especially around the knees. I'm still wearing compression.
Are you?
Okay. So for 2 weeks post-op, you have to wear compression leggings 24/7. Okay. During the day, during the night, 24/7. Okay. Excuse me. After the 2 weeks, you only have to wear it during the day. So at night, you can take it off. And my doctor has asked me to wear the compression up to 12 weeks post-op. So I'm still wearing the compression, which I'm excited to
let
that go. It does provide like a little bit of support. So it does feel better sometimes to have it on. Oh, yeah. Okay. So probably won't give it up. I will need to wear it again. Like, say if I'm noticing I'm swollen, or if I'm noticing more inflammation, I should probably wear them again. If I'm traveling, if I'm going on an airplane.
I was just going to ask.
Yeah. Oh, before I got the diagnosis, or I had thought that this is what I had flown to Canada, and I couldn't even sit down on the sofa because I was in so much pain. Oh. Yeah. It's been an interesting journey. Yeah. It really has. So I'll probably wear compression anytime I travel. The legs. Yeah, I likely won't. I'll put the leg surgery kind of off to the side for now and decide if I want to come back to that. I do want to maybe have my arms done next.
Okay. Is that supposed to be as bad?
No, it should be less. Yeah. Because with gravity, like everything goes down to the legs, right? So even walking around a little bit will cause swelling in the legs or the feet. One of my feet were really swollen for a long time.
Oh yeah, I remember that.
Yeah. It feels like it right away post-op. I think I told you it felt like my legs were water balloons that were like blown up too much, and they were about to explode. It felt like that for a few weeks. The recovery was quite long and quite difficult.
Oh, that's what I was going to ask. So then what about the day-to-day management for yourself?
Yeah, a lot of the things I've already talked about, just making sure I'm drinking a lot of water, making sure I'm eating an anti-inflammatory diet, making sure I'm not, I don't, right now, post-op, the day-to-day management, you mean? So I'm still wearing the compression. I've eased my way back into working out or exercising. Yeah, but not extreme. There's a couple stretch Pilates classes or stretch kind of classes at the gym I go to. So I've been doing those. Okay. I'm walking, but I think I'm ready now to start going a little harder. I wanted to make sure I wasn't, after a gym workout, your legs will hurt. I didn't want that on top of the post-surgery pain. Yeah. So I've been easing into it. So, but yeah, I'm feeling pretty good now. I think I'm ready to get back in there. Yeah. I won't go back to the HIIT type exercises. I won't go back into that high intensity training. I'm not going to do that to myself.
Right.
Yeah.
What do you wish you'd known years ago, or what would you say to someone who suspects that they might have lipedema but feels dismissed?
I would probably suggest that they try their best to find a doctor that will listen to them.
Is there a certain doctor that you can like a name that you can Google?
There are I don't know the agent. Like there is I want to say it's an agency that's online where you can look up lipedema providers in your area in North America, I think, or maybe just in the States. I'm not sure. I don't know what it's called. But like it's something typical, like Lipedema Organization of the United States or something like that, Lipedema Organization of the World, or something very obvious. But you can look up and it'll show, like you can put in your area and it will find a provider near or close to you.
Okay.
Near, close. Find a lipedema provider in your area or in your surrounding area.
Okay.
I would keep trying until you find somebody that listens to you, because that, like I said, that first appointment for me was a huge weight lifted off and changed the way that I talk to myself. It changed the way that I look at myself, and it changed it. I have made decisions based on that, like surgery.
Right.
And so that was huge for me. So even just having somebody to talk to that gets it was huge for me. So I would suggest doing it. Just keep trying. So
now, with like what you were saying with how you treat yourself now and how you talk to yourself now, is it completely different?
No, because I've been talking to myself that way for, 40, 50 years. So no, sometimes I'm still pretty hard on myself. And sometimes I don't treat myself in the best way. Okay. So I'm still working on it. It does help to know that for all those years, it wasn't my fault.
Now with 2025, now behind you, now we're into 2026. What are you hoping your year looks like for you?
I think a lot of healing.
Yeah.
A lot of healing physically. I'm still healing from the surgery, potentially going to have another surgery. So there will be healing to that. And like, I don't want it to come across like surgery was like, yeah, let's do it. Let's get it. Like an easy decision. It absolutely wasn't. I struggled with that decision because anytime you go under the knife,
I remember that.
It's something you should consider and something you should take seriously. I know, like, we're hearing it constantly. This person got a facelift. This person got a boob job. This person got a tummy tuck. And it just seems like it's like common practice and something that, and a lot of people are doing it. But it is still a major decision, and it's not something to take lightly, I don't think. So for me, it has been, and it was. And so to now think about doing a second surgery, I will go through that all again. Think about, is this the right choice for me? Is this something I want to do? Do I want to put my body through that? Am I emotionally ready for that? So a lot of healing. I'm hoping to, because journal more, get some of these thoughts out there, maybe look at posting more on social media, sharing my story a little bit more, because it's been tough. And a lot of this, I think, could have been different if I knew earlier.
Right.
But yeah, I would say that my focus for 2026 is healing.
Rightfully so.
Yeah.
Yeah. Well, thanks for sharing your story, because I know that it was very hard. And you went back and forth if you were going to share it or not. And I think that there's so much good that can come out of it, and there's so many people that you're going to be able to help. Just even through this one podcast. Right. Yeah. So thanks.
Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!